Why we're here is because of the fact that we know there are people out there who can't afford medical care. We know there are people who have insurance but who don't have access, because there's a big difference between being insured and having access.
The problem with America's health system is it's not there. It's not there for the people to take advantage of. So the clinic picks up that slack.
Outside of the health world, they have a lot of things that they're dealing with. Are they going to be able to get dinner on the table? Are they going to have electricity? Are they going to be able to deal with the problems with their child at school?
They need support. They need medical support, they need mental support, they need spiritual support all around. So we have a lot of people that fall into that category.
All right, so now we're going to place her in the middle, and then we're going to take off her.
We have a great program that is called Sliding Scale, and that is based on income and family size. We don't turn away nobody, regardless of their insurance or of their way of payment.
We did not always have health insurance. My son came to the clinic with a urinary tract infection. Turned out that he also had an appendicitis with no health insurance. That was a $50,000 bill. They helped give us the connections to find the people to help us get him insurance.
You know, without my needs being met, you know, I wouldn't be here.
Well, we're very excited for this new facility. Our old facility, we were in 3 buildings on West Napa Street, and now we're in a large building. It's 3 times the size. We went from 8 exam rooms to 19.
We had to leave the old building because we could not fit all of our services there, and we were growing, the community is growing, so obviously the health center needed to grow in order to serve the whole community.
So originally, we were looking at building a building for about $6 million. Came in after we got the grant and found out that there was no way we were going to be able to build a building for $6 million. Literally had to double the budget, and then had to go out in the community and ask, can you help us do this? And we have had great response from the community.
Well, Senator Thompson has been very vital in getting monies in our direction to help us become a viable clinic. But funding is always a struggle, especially when you're taking care of individuals that don't have the finances to take care of their own health needs. Somehow this needs to be paid for. As with anything these days, nothing is for sure, and you can have the best of everything in front of you, but if the finances aren't there to keep it running, it will fold.
We were always fighting. The thought was, with the Affordable Care Act, that all of the patients would be insured, that all of the community health centers' financial roles would go away, and that they could roll back our federal grants. And so right now there's a bill on the floor where they're looking at reducing our federal grant by 70%. And for us, that would be financially difficult for us to overcome. We get about $1 million a year in federal grants in order to run this facility. Most of the trends in healthcare are first found at community health centers. And the federal government knows that when they start at the community health centers, it's about 3 to 5 years before it's found in the general population. So the diabetic crisis actually started in community health centers. So in lots of ways, community health centers are now more innovative, they're more dynamic, and they're more user-friendly.
People are so shocked when they come and see, because a lot of people think clinic, old place, kind of dirty place, dark, and they come and see this beautiful, big, bright health center.
It's excellent the way you get treated here. You get treated more like you're in a home environment.
It brings back what medicine's supposed to be about. It's about that human connection, it's about partnership, it's about listening, it's about trying to be advocates for your patients. And that's not always the case in medicine, to be honest with you.